Hey, everybody, welcome to this episode of Compassion and Courage Conversations in Healthcare. I'm your host, Marcus Engel, and this is the podcast where we teach compassionate communication, provide perspective, and inspire resilience. Today, I am excited to talk to my, hopefully, I can call you a new friend, Angie Osborn. Angie, thanks so much for spending some time with me today.
Thank you so much for having me.
Sure. So we met through the Mom and Mitchell Foundation briefly, and tell me a little bit about who you are, and tell listeners about who you are, what you do, and maybe how you became involved with the organization that's promoting mental health and suicide prevention.
So, I am a psychiatric mental health nurse practitioner in the state of Oklahoma. I opened my own clinic in October of 2024, and I became
Congratulations.
an
That's
thank you.
that's very recent, and that's a big accomplishment. Congrats.
Thank you. And we're doing really well. We're very busy. I got involved with the foundation through a mutual colleague who thought that I could bring something to the team that you guys maybe were missing because we didn't necessarily have a mental health person on the team. So that's how I got involved.
And what does your clinic look like on a day-to-day basis? What's a typical Monday through Friday look like for you? Or is there
Uh,
such a thing as a typical Monday through Friday?
there is not necessarily a typical Monday through Friday, but my patient population is pretty mixed. So I see patients anywhere from the age of 5 to my oldest previously was 87. Now I think my oldest is 68.
Okay.
And I see anything from kids with ADHD, behavioral problems, to addiction. I also take care of patients that have schizophrenia, bipolar disorder. I treat family systems. I do family therapy. I tend to do medication management with psychotherapy with every single patient that I treat.
Beautiful, because that's an often missing component, is it not?
Absolutely. It's not something that we really offer anymore, but my mentor, and he's since passed away, but he was only with me for a few months whenever I was a brand new nurse practitioner on my own. And that was something that he was very passionate about. And I feel passionate about it. And I do notice a difference within my patients when I provide that alongside therapy.
Can you tell me about him? Can you tell me about your mentor? Because I one of the questions I often ask is who taught you leadership and who mentored you? And this sounds like a significant relationship.
Well, he was only with me for a few months until he passed away. So he was the medical director of Red Rock here in the state of Oklahoma. So his name was Leland Dennis. I was only with him for a few months, but for that time, I could call him with any issues that I had with any of my patients. So the initial clinic that I was started at has a very diverse rural population, and some of those patients were really difficult. Uh, Sometimes I felt a little bit over my head whenever I was starting out. And anytime I had an issue or I felt like, oh, I really don't know what to do here, I would be able to call him and he'd walk me through, what my treatment plan options were once I discussed with him what I wanted to do.
What's your favorite part of what you do? And what's your least favorite part, I suppose?
My favorite part of what I do is when the patients come in and they're doing better. That's probably my favorite part. My least favorite part is when they come in and they haven't been following my treatment plan that we decided upon, and then nothing has changed. And then they expect something to have changed even though they haven't followed through on their end.
That has to be rather frustrating as a provider, I would think. And especially in this population, we have to have so much more grace that
Yes.
that this is a different population than, say, your average GP clinic. So how do you dig down deep to come up with that compassion and grace for those patients that may not adhere to the plan?
Well, I've always been taught, my mother always taught me that it's not our job to judge people, it's our job to help people. So that's kind of the way that I roll.
Mm,
And I give them chances. I don't expect them to be perfect, and they know that. But we also have to have boundaries of what we will continue to allow. And I established that pretty early on, immediately. Of if we want to get better, we have to participate in our care. That's the only way that we get better.
right. I love what you said there about not being judgmental too. When I'm working with my students at Notre Dame, we use a four-part definition of compassion, which is witnessing suffering, being moved by that suffering, having a desire to ease it, and then actually doing something
Hmm.
about it. And I'm a simpleton, so I like to distill that down even more to a definition of compassion that is non-judgmental awareness.
Absolutely.
Non-judgmental awareness, and I think that's what you're talking about, right?
Absolutely. I
How do,
try to cultivate my office, my life in a way that allows people to be their full self whenever they meet me. And I move in my life, in my professional life, the same, no matter where I am. I think authenticity is another way to do that.
yeah, big fan of the authenticity that Brene Brown puts out into the world and the vulnerability work that she does too. Did you always were you always drawn to like the caregiving professions? Is this something that you always wanted to do?
Well, when I was in high school, my mother told me that I was expensive and I better figure out something that I could do that would give me a good job, that I could take care of myself. And she worked as a home health aide for my entire life. So I went with her from when I was really little on the weekends, sometimes before school, to sit at the nursing homes while she went and took care of patients. While she would get them ready, I'd sit in the lobby and kind of hang out with the elderly clientele. we got we got to know each other pretty well during those times, and I found out pretty early on that you could connect with people, and that kind of got me interested. But I didn't really know at that time, when I was a kid, that maybe this could be, a future thing. So in high school, they offered an LPN program, and one of my teachers, Miss Rodriguez at the time, encouraged me to go into that program or to apply for it. So that's kind of what pushed me into becoming a nurse. Probably because I would get in trouble for defending others. I've always been someone that has defended people that people would try to take advantage of or make fun of. And she thought I would be a good nurse.
Justice minded kid, better a nurse than a judge.
Yes.
I love that. So, on the podcast, I always ask people to share a story about compassion and about where they witnessed it in their life, whether receiving it. And that's the same assignment that my students receive at the beginning of every semester. And you wrote briefly, but I'd love to hear your story. And I'd love you to tell the story in your own words about Margaret and the I guess how would you say the aspirations that she had for you, probably still does have for you.
Yeah, I actually spoke with her this morning.
Mm,
I spoke with her this morning. Um, so I met her right at the time when I was about to graduate from high school. And I was in the LPN program going into the summer semester to finish it off as an adult. My mother was working as a private caregiver, and they were looking for someone to come and take care of her husband at the time. And I didn't know that that's what I was going over there for. I didn't know that it was a job interview. I didn't know what was going on. My mom just said, "Hey, we're going to go over here. I have to take care of something over at this house." So we went into a really nice neighborhood, a very nice neighborhood, not something that I was used to being in, really. And I was like, "What are we doing here, Mom?" Like, we went into the house, and like there was like a whole family there, and I went out on the porch, and we were hanging out, having drinks, and Hans was there, and he needed some help with something, and I just was like, "Oh, I can help him with that." So he was in a wheelchair, and I just took him inside, and I went in and started helping him. And immediately, I was just in there helping him, and it was with some ADLs, so he just needed some things cleaned up. And then I was there. I showed up. Literally, I remember the outfit to this day. I had a white skirt on, some little heels, and a green tank top with like a white little shirt over it. I had no idea what was going on. And I'm just in there helping clean him up, talking to him. And then a few minutes later, his daughter walked in and said, "Hey, can I talk to you for a minute?" And I was like, "Sure." I was like, "Let me finish with him." And I took him back outside with my mom and his wife. And her name is Ellen. And she asked me if I would be willing to care for him whenever I wasn't in class. And then Margaret came in and we had a discussion about it. And I was like, "Well, I don't have a job right now. And I probably need to get a job because my mom was getting ready to leave the state." And that's how we connected. So I took care of him for almost a year every single day. I would go after classes and twice on the weekends. And she inspired me to go to college. I had never really thought about going to college before. I was pretty happy just to become an LPN at that time. Mm-hmm. So during that time, they were higher educators, both of them. Mm-hmm. He was chancellor of Oklahoma at one point, and I know that they're fine with me discussing these things. So I took care of him, and I would take my work over there as well. I would study over there. I literally would read to him, and he would be falling asleep, and he would wake up, and he would tell me to keep going, and it would just make me laugh all the time because I knew he would be tired. And Margaret would teach me how to cook certain things that I had not been exposed to. And the whole time, while I was also struggling because my parents had separated, and that was not something I had foreseen happening. She was struggling, and we just connected with each other. I don't think that anybody really understood why that was happening. I think some people were maybe a little suspicious of it too. You know, a Puerto Rican kid coming into a higher class neighborhood with this, more affluent white woman. What's going on here? And there was not ever anything nefarious, obviously. We just really cared for each other during a time that was really hard for both of us. And she just kind of taught me a lot of things about life that I had never been exposed to, and encouraged me to reach for something that I didn't even know was possible.
So you had your mother and Margaret, and I suppose Hans as well, that were all slowly but surely guiding you in some directions and challenging you to be better, and that's a beautiful thing. Mm-hmm. Do you have people that you mentor now, like you were mentored?
So I'm currently mentoring someone, and they're sitting behind me.
Okay, great. Do you want to introduce this individual?
Her name is Megan. Do you want to come over here?
Yeah. Hi, Megan.
Hello. So she is a nurse practitioner, currently a family nurse practitioner, and she's working on becoming a psychiatric nurse practitioner.
Wonderful. Wonderful.
So
Good luck to
she is
you.
going to be with me for the next year and a half.
Okay. So this is residency then, so to
Basically.
speak? Okay.
Basically,
Yeah.
yes.
Okay. Wonderful. Well, good luck to both of you in this next year and a half relationship. That's
Thank
exciting.
you.
That's exciting. Um, whenever we talk about this type of this branch of medicine and clinical professionalism, there's part of me, because I grew up back in the 80s and 90s, that is always going to have a little bit of the stigma,
Hmm.
right, of mental health, and the idea that if I seek mental health, that I am, and I'm talking about the feelings that I personally gone through here, that I am less than, or that I am weak, or that any number of poor self-talk sort of things. Other than people like me who had to get over their own stigmas, what do you think that the general public gets wrong about mental health?
Well, I think one of the things is that mental health isn't really separate from health at all. That's the first thing. They all go together. So that's the first thing. And everyone, literally everyone has mental health problems at times, right? We may not have them all the time, but we do have problems at times. We've all had trauma. We've all been exposed to different things. Sometimes we're depressed. Sometimes we have anxiety, depending on the situation. And if we can be more compassionate about those things, then maybe the world wouldn't be so hard, right? I think
Yeah.
stigmatizing things makes people hide and makes things worse. We end up with more abuse that way. We end up with more suicide that way. When we're scared to say we're suffering, we suffer alone, and then we end up doing things that maybe could have been avoided if we had someone that we could trust not to hurt us or make us feel worse about the things that we're feeling or thinking. So I think the stigmatization of, having, a mental health diagnosis, even if it's just depression, I think is, unfair and really unrealistic because in the world right now, just in the United States, even, people are really suffering and it's really hard, you know? Working class people with children are having a really hard time right now. Everything is so expensive, everything is really hard. And we need to have compassion for that and for each other.
So how do Joe average people like me? It makes a lot of sense, of course, in your work um, that you're taking care of people. How do normal, quote unquote, normal citizens like myself, how can we best support people at the same time? Obviously, not in the clinical ways that you can, but just in general, how do we support people?
I think some of the best ways to support people is by learning to listen, right? So, one of the things in psychology, is learning to actively listen, not passively listen. I think that many people listen to respond, they don't listen to understand. So, when we do that, we center ourselves in the situation. So, if I come to you and I say, man, I'm having a really hard time and my dog died, and then we immediately come back with, oh, well, you know, that's really hard. But, stuff like that happens every day. You need to just get over it. You immediately invalidate the feelings that that person is having. The easiest way to fix that is by validating them, right? Because everyone wants to feel that they are important. And it doesn't take much to do that. That the things that they say and who they are matter. So if I was that person and they said that to me, I would say, man, that's really hard. That sounds terrible. I am so sorry. I know there's not anything I can do to make you feel better, but I'm here for you.
I'm
Those are
listening.
the ways to get those kinds of things going whenever we want to talk about how to be there for one another.
It's not rocket science, right?
It really isn't.
And yet, sometimes we have so many distractions. We have so many hangups. We have so many our phones going off every 3 seconds that can exacerbate that suffering even further and take us out of the moment. But I love what you said about that active listening is it's a gift, right? It's a gift for the other individual.
Yeah, we all want to be heard. We all want to be seen. This is doubly true for children. I have a lot of parents sometimes that bring their kids in and they're like, they just don't listen to me. They just don't listen to me. Well, we don't always listen to them. I can say this as a parent. I understand. We're so busy and we have so many things going on. But if we don't listen to them, if we don't model the behavior that we want to see, then they're not going to have the behavior. It's the same thing out in the world. If we don't model the kind of behavior for others, then they can't learn it if we're not exposed to it. That is one thing that I learned from Margaret. I didn't know how to actively listen. I wasn't raised that way. I wasn't raised to pause. I was raised to react. And we can't always be in a place of reaction. That's how you fix things. We have to be in a place of understanding, in a place of relaxation at times, even when we are triggered. And we have to deal with our triggers. That's the other thing. We can't walk around triggered all the time. That's your own bias with things. Something that bothers you consistently is something that you have to deal with. If your feelings get hurt over every single thing that you see, then that is something that you need to work on. That's how we stay divided. If something is bothering you consistently, then we need to figure out why it is bothering us. There's something called the cognitive triangle. We have our thoughts, feelings, and behaviors that follow it, right? So you think about something, and then we have a feeling attached to it. That feeling will force a behavior, okay? If
Following? Yeah.
if we can figure out where that is coming from, right? That behavior, because a lot of times it's behavior that we see out in the world that we're like, why did that guy do that? Why did that lady do that? Especially right now, what's the biggest thing? A Karen, right?
Mhm.
Why did she do that? Well, she felt a certain way and she couldn't handle it. She was dysregulated. She couldn't handle it. So then she reacted. So when we're dysregulated, that's when you see poor behavior.
And I love what you said about we've got to know our own triggers so that they don't take over our lives. And I often feel like sometimes whenever we're triggered, it just brings on more triggers. We get into a pattern of being triggered. Am I off on that?
No, you're absolutely right. I call that we call that downstairs braining it. You know, there is an educator that I really like. His name is Mr. Chaz. I actually have his posters in my kids' room.
Mm-hmm.
If you are utilizing the downstairs part of your brain, where we rely on emotional thinking, there's no rationale there. We've got to get to that frontal lobe, right? So getting to the frontal lobe is difficult. So then you just keep following through on those poor behaviors because you can't access rationality. There are ways to get us out of that. One of the biggest ways is with some mindfulness or some deep breathing, taking a pause, right? Whenever you get really angry, what happens? You start clenching your fists, knowing your tells of like, why am I getting angry? Well, if you don't know why you're getting angry, start recognizing what it feels like in your body. What does it feel like when I'm angry? Well, I start to clench my hands, or I grind my teeth, or I get flushed, right? My heart races. I get short of breath, or I start clenching my shoulders, or everything gets tight. These tells can assist us to start deep breathing, practicing relaxation so that we can think clearly before we react. But again, a lot of us didn't get that teaching when we were small, so we don't have the tools that we need, especially as adults, to be able to do those things.
And it's something that, at least for people like me, I'm going to spend a lifetime developing these skills because I didn't get it as a child. So now I've got to learn as an adult, and we're never too. Hopefully, we're never too old to stop learning.
We are never too old. I didn't learn it until I was an adult. I'm still learning it. I still get triggered. Like, my kid triggers me sometimes. And I recognize it, and then I pivot. We have to keep wanting to learn. We have to keep wanting to get better. And I think that's another way to help with mental health, is that we have to want to get better. We have to want to support each other. We have to want to see people do better.
Intentionality is the word
Yes,
that I keep thinking of.
absolutely.
Nice. So, kind of random question. One I always just like to get to know people a little bit better. Let's go back to the time you were in high school. You said that you were started helping with the family just after high school. Uh, you're 16 years old. It's Friday evening. You're hanging out with your friends, or it's after practice, or it's after work, something like that.
Hmm.
What are you listening to at that time? I hear the chuckle.
I mean, I guess it depends on who I'm in the car with.
Yeah.
Let's see who. I'm like the immediate response is this is terrible. um
I like terrible answers, so I'm really interested to hear this.
well, I mean, it's not terrible,
Yeah.
like, because I still listen to these things, and like it was really like club music and stuff, but
Mhm.
I'm like, the kinder answer would be like Britney Spears, right? Because like I
Yeah.
loved Britney. But definitely we listen to a lot of like Yin Yang Twins.
Hmm. Hmm.
Hmm. A little Genuine. Liked that a lot. What else was I listening to then? Oh, if I wasn't listening to that, I did really like what was that? Haley is her name, but that's not the band. Paramore. Thank you. Loved
Yeah.
Paramore. So listen to that a lot in high school too.
Nice. Nice. There's a great book out there that I recommend to people called This Is Your Brain on Music,
Uh-huh.
and it's a really good look at the neuroscience and music mixed together. It's a pretty cool book if you want to check that out. And speaking of books, another question that I always like to find is what are you currently reading, or what would you recommend that I or others should read?
So I literally just had a few of my patients pick up a book on boundaries. It's literally called Boundaries,
Hmm.
and that you can get on Amazon. And then Do Not Believe Everything That You Think. That is also another book that I really like.
So, is this the original Boundaries book?
Yeah, it's been updated recently. I can look in my Amazon real quick at that. The one that I told my
I
patient
think I
to
know what you're talking about, actually. So,
It
this
is
might.
Boundaries, when to say yes, how to say no.
Okay.
To Take Control of Your Life by Henry Cloud. I like that one a lot. That one is great for people that struggle with people pleasing tendencies.
Mm.
It's sometimes we want to be liked.
Mm-hmm.
We
Mm-hmm.
want to be liked, we want to be understood, and sometimes we think if we can do more for people, then they're going to see us in the way that we want or love us in the way that we want. And that isn't necessarily true.
I try to remember that we are human beings, not human doings.
Exactly. I think that is a great way to go about things. That's one. And then actually there's one that I always tell my parents that they should do as well. Hold on, let me pull that one up because that one is really good. But I think also the do not believe everything that you think. That one is really good for people that struggle with their intrusive thoughts. Whenever we can't get away from things that just keep coming up over and over and over again. Because sometimes we have negative thoughts that we can't let go of, and we really start to believe that. Our brain believes whatever we tell it to. So if you believe that you're terrible, you're going to be terrible, right?
Right. Right.
If you think that, you're never going to amount to anything, or that, you don't deserve better, then you're going to move like that.
Yeah.
So we have to work on that. We have to continue every day to pivot and have a growth mindset. And that's really hard, especially when our brains are kind of tuned to be negative.
So, with my last question for you, and maybe you just answered it, but if you had the world's largest billboard on the world's tallest mountain, what is the message that you would broadcast to humanity?
What would I? What I would really like to say is that we're all really the same, and that we need to be kinder to one another and listen to one another. I think we're separated due to, you know, the media is a huge part of that. They separate us for all the wrong reasons. And then we lean into that because we have negative minds automatically. But when you go out into the world, it's not always like that. I think that the media definitely, especially right now, would like for people to believe that everyone hates each other, that everybody's bad, and that nobody cares. And I don't think that that's really true.
Mm-mm. No, no, there's far too many people like yourself who are natural caregivers out there, just in general population, that show me that our world is not going to hell in a handbasket. No matter what the news says, no matter what the media keeps reporting, we're and that's what we're doing with this conversation and with this show is just trying to build a little bit more compassion out in the world. So, Angie, thank you so much for being with me today. Is there anything else that you'd like to say to listeners, or any other advice or guidance that you'd like to give before we wrap up?
Well, I think probably one of the biggest things when it comes to mental health is if you have a child that is struggling with mental health, then we need to think about how that has come about. So much of what I see a lot of times is that if a kid is struggling with mental health, then probably a parent is too.
Mm.
So let's not push everything off on children, and let's treat everyone And the biggest part of that is going to be with therapy and learning how to communicate better. You know, a dysregulated adult is not ever going to regulate a dysregulated child.
That's some profound wisdom right there. A dysregulated adult is never going to regulate a child. Wow. Well, food for thought. Thank you so much, Angie. I appreciate you being with me, and I look forward to working with you in the future.
All righty. Thank you so much. I really appreciate it.
Thank you, Angie Osborn. And listeners, thank you for being on this episode of Compassion and Courage. I'm your host, Marcus Engel. This is the podcast where we teach compassionate communication, provide perspective, and inspire resilience. Please visit marcusengel.com for Speak Moon and for books and consulting and all those kind of fun healthcare needs that we have. Appreciate you all being with us, and we'll see you on the next episode.